President Nana Addo Dankwa Akufo-Addo on Friday commissioned a $30 million cocoa processing plant at the Cargill Cocoa Processing Company in the Tamafri Zones enclave in the Kponkatamanso municipality in the Greater Accra region. The investment is expected to increase the company's cocoa grinding capacity by 20% to match the growing consumer demand for cocoa powder. The expanded facility will bolster Cargill's annual production capacity to 90,000 tons and support hundreds of new direct and indirect jobs. At the commissioning ceremony, President Akufo-Addo commended Cargill for expanding its production capacity at a time when many other businesses across the world are cutting down production.
I'm delighted to join you at this inauguration ceremony for the plant capacity extension works of this global company in these times of COVID-19 pandemic, when generally industries across the globe are scaling down due to uncertainties. This milestone in the history of this company is commendable. Over the past decade, your contribution to the growth of the Ghanaian economy in terms of investment and exports is worth celebrating. Having increased your initial investment of $100 million United States dollars in 2008 to some $130 million United States dollars in 2021.
President Akufo-Addo said the expansion of the plant highlighted the importance of the private sector to the government's vision of a Ghana beyond aid. To achieve this vision, the government, the president said, had focused on laying a strong foundation for economic transformation by restoring macroeconomic stability, stimulating the private sector through business regulatory reform, and restructuring the financial sector to ensure easier access to finance.
The completion of this expansion underscores the importance of the private sector in government's industrial transformation program, which is recognized as an anchor to the Ghana Beyond Aid vision. To achieve this vision, government has focused attention on laying a strong foundation for economic transformation in our first term in government by restoring macroeconomic stability, stimulating the private sector through business regulatory reforms, and restructuring the financial sector to ensure easier access to finance. We also embarked on ambitious and transformative flagship programs, such as the One District, One Factory initiative and the Planting for Food and Jobs program, aimed at accelerating the structural transformation of our national economy to move it away from dependence on raw material production and exports to a value-adding economy.
President Akufo-Addo urged other investors to take advantage of the business-friendly climate in Ghana and invest in the country. He gave his assurance that Ghana will continue to create and maintain an environment conducive to investment, one which guarantees not only the safety of money invested, but also good returns.
We cannot achieve a Ghana beyond aid if we continue to export raw commodities. It's against this background that my government is providing a conducive environment to help the private sector engage in production and value addition activities. I'm glad that we have been able to increase the export of processed cocoa by some 31% between 2016 and 2019. It is important to indicate that although the degree of value addition to our cocoa has increased in the past 4 years, I believe there's still room for improvement. Government will continue to offer incentives such as tax rebates, import duty exemptions for the importation of capital goods, and tax holidays to boost the competitiveness of local manufacturing companies that are adding value to our local raw materials. Government will continue to ensure that trade remedies and safeguard measures, which are crucial for the growth of domestic industries, are effectively implemented.
The president of Cargill Cocoa and Chocolate International, Harold Perlmer, explained that the project, which was sparked by the growing global demand for cocoa, also supports the company's long-term commitment to invest continuously in the cocoa sector and create more opportunities in the value chain.
I am particularly happy to be here today to celebrate another milestone in the life of Cargill Ghana. It's also refreshing to see some familiar faces that were present from the start, as we also celebrate a remarkable 13-year journey of our operational presence in Ghana. Right from inception, the support of our Ghanaian friends has been heartwarming. It's also important to recognize the great work that our Ghanaian team has done in running the plant and serving our customers worldwide with quality Ghanaian cocoa products. At Cargill, agriculture is how we deliver our sustainability commitments and empower cocoa growing communities. Our vision is to build sustainable and robust agri-food businesses in origin countries to help the world thrive. This requires that we continue to innovate and develop our business and provide our support to build the institutional framework that allows the agri-food sector to grow and flourish.
The plant expansion project, Mr. Perlmer added, aligns with the government of Ghana's efforts to accelerate economic progress through agricultural industrialization while improving the welfare of farmers and buttressing Ghana's position as one of the world's largest producers of cocoa. Cargill Ghana has been buying cocoa from Ghana for over 40 years and opened its state-of-the-art cocoa processing facility in Tema in 2008. The company has now over 330 permanent and contract employees processing cocoa products to service food and confectionery clients locally and around the world. The Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, has stated that no case of the heavily mutated new COVID-19 variant named Omicron has been identified in the country. Addressing a press briefing on Sunday in Accra, Dr. Kumar-Boaje urged the public to disregard false messages on social media about an Omicron variant case being recorded in Ghana.
We have not identified one in Ghana. All people who are tested positive at the airport are sequenced, the samples are sequenced, so they've reported all of them. We also pick samples from our reference labs across the country to do sequencing. Currently, they have a bunch of about 160 that they are working on now, but there's been no indication of Omicron in Ghana. So all those messages flying around is not true. There's no case in Ghana.
He said the Ghana Health Service response to the new variant was similar to previous variants and will be hinged on preventive measures such as the wearing of masks, vaccination, and social distancing.
The issue about Omicron is that whatever it is, vaccination is key, social distancing is key, wearing of masks is key. So the preventive measures remain the same. We have not had any evidence that it will pass through a different part of what we know now. So all the mechanisms that are in place continue to work.
Omicron was first reported to the World Health Organization by South Africa on Wednesday, and early evidence suggests it has a higher reinfection risk. Cases of the new variant have also been confirmed in several European countries, including the United Kingdom, Germany and Italy, as well as Botswana, Israel, Australia and Hong Kong. In response, a number of countries have now banned or restricted flights to and from South Africa and several neighboring nations. Dr. Patrick Kumar-Boaje also disclosed that the Ghana Health Service has declared December as vaccination month to ensure more Ghanaians are immunized against the COVID-19 infection. The group of persons to be vaccinated during the period include all government workers, security personnel, health workers, staff and students at secondary and tertiary education institutions, commercial drivers and their mates, as well as staff of the three arms of government. Dr. Patrick Kumar-Boaji said the service will reinforce the monitoring and enforcement of existing COVID-19 protocols in collaborating with the security agencies. The vaccinations will be undertaken at lorry parks, markets, churches, mosques, and sports stadia, he said, and urged the public to cooperate with the vaccinators for a successful exercise.
With the increasing availability of vaccines and reasonable quantity in the pipeline, we are declaring December as the month for vaccination, or let's say vaccination for Christmas. So December is going to be declared as the month of vaccination, and it will be launched by the Honorable Minister on 30th of November 2021, that's Tuesday coming. This mandate, which I'm going to announce, will be applicable in January 2023 at specific groups and manners as soon as, and this mandate become effective as soon as the campaign is over. We have them in two sections. They are going to have proposed groups that will be covered under the mandate and the venues. We are looking at all the three arms of government. All health workers have been given the opportunity to vaccinate, and they stay in a very strategic position that either they can share among themselves or give to their patients. So that's why we prioritize that. Personnel will be covered. They should be vaccinated. All staff and students in secondary and tertiary schools should be vaccinated. All workers in government institutions and parastatals, all commercial drivers and their mates are expected to be vaccinated at the end of that. That's where they're commanded to cover them.
Touching on the Ghana Health Services strategy for the upcoming Christmas, Dr. Kumar-Boaji said the service will reinforce response mechanisms to the anticipated surge in COVID-19 infections, strengthen contact tracing and follow-ups, as well as improve risk communication and provision of more reagents for testing. He announced that between December 2021 and January 2022, one must therefore be vaccinated before entering nightclubs, restaurants, beaches, and sports stadia.
So in preparing for Christmas, we are going to ensure that we have our logistics are prepared. Logistic management, whether test kits, etc., that needed to be able to anticipate any surge or also continue our surveillance to be able to look at that. We want to use the opportunity also to appeal to specific institutions to institute and monitor adherence to the protocols at their workplaces, including vaccination mandate. They feel that they have given opportunity to people to say that in this bank, for example, if you are not vaccinated, you can't come. There are areas where the mandate will cover. That will be a venue. And this venue for now includes nightclubs, beaches, sports stadium, and restaurants for indoor dining. And these are areas that it would mean that you need to be vaccinated before you can go into these venues, and that will be enforced.
Dr. Kumar-Boaji also gave an update on the current situation of the COVID-19 virus in Ghana.
What's our current situation as far as the numbers are concerned? We have a totally confirmed cases of 131,082. We've done about 1.98 million tests so far since the beginning of the pandemic. About 129 of the 131 have recovered. We are reporting a total death of about 1,220, with the current active case of 22, severe cases of active case of 713, severe cases 22, and currently we do not have anybody in a critical situation in our facilities.
Nearly 2 years into the COVID-19 pandemic, the world is racing to contain a new coronavirus variant, potentially more dangerous than the one that has fueled relentless waves of infection on nearly every continent. The World Health Organization panel named the variant Omicron and classified it as a highly transmissible virus of concern, the same category that includes the predominant Delta variant, which is still a scourge, driving higher cases of sickness and death in Europe and parts of the United States. As fears mount over the newly identified coronavirus variant Omicron, governments around the world are scrambling to protect their citizens from a potential outbreak. The new mutation which is potentially more transmissible, was first discovered in South Africa and has since been detected in Australia, United Kingdom, Germany, Israel, Italy, the Czech Republic, and Hong Kong. Israel is banning all foreigners from entering the country in response to Omicron fears, authorities announced on Saturday. The ban, pending government approval, is expected to last 2 weeks. Israelis returning from a country on the red list, which includes countries in Southern Africa, will be required to isolate for 7 days in a designated hotel. There are 7 suspected cases of the variant in Israel, in addition to 1 confirmed case found in a person returning from Malawi. 2 Omicron cases have been detected in Australia after travelers from Southern Africa arrived in Sydney. The 2 travelers are in isolation along with 12 other passengers who came from Southern Africa. Both cases are people who are fully vaccinated and asymptomatic. Australia has banned the entry of foreigners who have traveled to 9 Southern African countries in the past 14 days, including South Africa, Lesotho, Botswana, and Zimbabwe. Meanwhile, South Korea has imposed restrictions on travelers from 8 Southern African countries, its Disease Control and Prevention Agency announced. The issuing of visas for nationals from those countries has been suspended until further notice. Foreign nationals from South Africa, Botswana, Namibia, Zimbabwe, Lesotho, Eswatini, Malawi, and Mozambique are banned from entering South Korea. Korean nationals entering from those countries must quarantine in a government-designated facility for 10 days. The National Security Advisor, Brigadier General Emmanuel Ochre, has assured Ghanaians that the security architecture in the country is on alert and focused on protecting citizens and the territorial integrity of the country against any terrorist threats. The National Security Advisor, who disclosed this in a media briefing at Wa in the Upper East region, said a multinational joint operation, dubbed Operation Kodelgo, was the 4th in the series since the Accra Initiative in 2017. He noted that the main objective of the operation was to fight terrorism and transnational organized crimes with their common border to free it from illegal and criminal activities within defined areas of operation. Brigadier General Ochre said the operation took place in all 5 regions of northern Ghana and in the same areas of neighboring Côte d'Ivoire, Burkina Faso, and Togo. He noted that due to the operation, there had been increased presence of security forces in the northern enclave, adding that these security activities were part of the planned programs of the Accra Initiative, which encompasses Benin, Burkina Faso, Côte d'Ivoire, Ghana, Niger, Mali, and Togo.
These security activities are part of the planned programs of the Accra Initiative, which encompasses Benin, Burkina Faso, Côte d'Ivoire, Ghana, Mali, Niger, and Togo. The multinational joint operation, codenamed Operation Kodango, the 4th, is the 4th in the series since the beginning of the Accra Initiative in 2017. The main objective of these operations is to fight terrorism, transnational organized crimes within our common borders, highway robberies, illegal mining activities, and other criminal activities within defined areas of operation. The operation took place in all the 5 northern regions of Ghana and in same parts of Burkina Faso, Côte d'Ivoire, and Togo.
Brigadier General Ochre clarified that the operation was not targeted at any group of people, but rather targeted at a network of criminals, adding that all the operations have been professional and intelligence-led. The National Security Advisor said they were achieving some security in the border areas due to the collaboration with the neighboring security counterparts to carry out cross-border arrests.
As the adage goes, when you see that there's fire in your neighbor's house, you don't wait till the fire engulfs him, but you fetch water and put it down in case the fire gets to you. We are not waiting for any fire to get to us. We are doing whatever is possible to prevent that fire getting to us. So all this we are doing year in and year out in these particular regions is to avoid, is to prevent any terrorist attacks on our land. This is a shared responsibility. It is not only for the security services only. It affects the people in the entire country.
The National Security Advisor said they were not waiting for any mishap, but rather they were doing whatever possible to prevent any attempts or attacks from occurring. The Joint Security Forces include National Security Operatives, the Ghana Armed Forces, the Ghana Police Service, the Ghana National Fire Service, the Customs Division of the Ghana Revenue Authority, the Ghana Immigration Service, National Investigation Bureau, the Research Department of the Ministry of Foreign Affairs, the Ghana National Ambulance Service, Forestry Commission, and Narcotic Control.